So it's so nice for you guys, for everyone to introduce themselves. I'm glad to see everyone across different countries, Africa, from Ethiopia, from South Africa, from Kenya. It just shows how passionate we are about digital health in Africa, and it was the theme for our discussion today. This is actually the second part of a series where we are talking about the future of digital health in Africa, specifically for this year, 2024. 2023 was offered a lot of insights and wonderful initiatives in digital across Africa, and we are happy and we hope that this follows the same for 2024. Once again, my name is Jide, the Programs Manager for Digital Health Africa, and I will be moderating this session. Our last session, we had a very good discussion on the current landscape of digital health across diverse countries, and we had participants share amazing insights of what is going on in their country and what they hope to see across this year, 2024. We focused on the needs, identify specific needs of patients, providers, and how digital health can play key roles, especially in terms of interoperability, standardization, and implementing common data formats and communication to enable efficient data exchange. We also discussed on security and privacy in terms of digital health in Africa. Where are we? Where do we hope to get to? And we also emphasize, most importantly, the importance of youth participation and meaningful engagement in Africa's digital health landscape. And today we'll follow suit, except that it's a slightly different conversation today. We'll explore the global digital health case study in Africa, and it's nice to have someone who knows what is what, who knows what is really happening in the digital health space in Africa. That's from Digital Health Monitor case study, guiding the current trends and initiatives of digital health in Africa. But first, let me introduce the organizations that have partnered together. It's been an amazing partnership with Elena to make this series come to fruition. So Digital Health Africa, which I'm a part of and which is the organizer of this webinar, it's a community that aims to leverage media and publication strategies to drive positive changes in healthcare landscape in Africa, whereby we are focusing on the transformative power of digital health. We hope to do this via disseminating information. If you follow our social media pages, you'll see we have a podcast, we have series on digital health terms, we have a lot of information that if you wanted to know anything about digital health in Africa, you'd certainly learn a lot from our social media platforms. And we also aim to do that via platforms like this, a panel discussion, webinars, fireside chats, and every event you can think of. As a matter of fact, that picture you see there, it was from our AI in Healthcare meetup in Lagos, Nigeria, and we are very proud to tell you that we would be holding one in Kenya very, very soon. So just stay glued to our social media pages for that, especially if you're in Kenya. So our vision basically is to be the foremost digital health media organization driving transformative change across the African continent. We aspire to be the heartbeat of digital health innovation, education, and advocacy, seamlessly connecting diverse stakeholders in the pursuit of a healthier and more connected Africa. Speaking about Elena simply is the Pan-African Health Informatics Association and the African regional body of the International Medical Informatics Association. So it's just the Pan-African quarter of the International Medical Informatics Association, and their vision is to transform healthcare in Nigeria, in Africa, through health informatics, research, development, implementation, and education. And now has really been of help to us, especially in the publicity of this webinar, and it's a wonderful collaboration and partnership we secured with them in this year, and we hope to bring up more initiatives that focus on digital in Africa. So moving on to today, I would like to introduce our guest speaker, Mr. Emeka Chuwku. Emeka is passionate about digital health-enabled care coordination and data use in middle-income countries. Personally, I have a first contact with Emeka. We happened to meet at a digital health community of practice event in Lagos sometime last year, and even though he gave a session on interoperability standards in healthcare, and it was really insightful presentation. And since then, I've sort of wanted to have Emeka on one of our events, and it's really nice and surreal to finally have him in our event today. In the last 2 decades, he has worked with stakeholders in the intersection of public health, clinical practice, and information technology to design, deploy, and improve digital health strategies, policies, practices, and solutions in low and middle income countries. Emeka helped facilitate the collaborative drafting of the several national and subnational digital health strategies. He is also the co-convener of Digital Health Interoperability Network, the Nigerian Technical Committee of Practice, focused on interoperability peer learning. So, Emeka, are you here? Can you please let us know if you are here?
Yes, thank you very much, Jide. Yes, I'm here. And a pleasure to join you and colleagues at Digital Health Africa for this session. Thanks.
Okay, just diving straight into the topic. Mr. Emeka, I would just like to know, based on your work in digital health space, what would you say are some of the defining characteristics of digital health landscape in Africa compared to other regions? I know Africa, for one, I think majority of Africa is still made up of developing countries. So compared to like advanced countries, what would you define the characteristics of our digital health landscape? Where do you think we are at the moment, and where would you like us to be especially this year?
Yeah, across board, Africa is not doing well, not just in digital health, even in a lot of other development indicators. So it's not like we are singled out digital health for Africa not to do well. But generally, the one that is worst performing of all the indicators is capacity. So capacity, that's workforce, whether to use, build, design, support digital technology, we are really, really doing badly. Of course, globally, that's also still a problem, but in Africa, we have not really gotten our act together. And I think that's where most of the change can happen. Can you hear me? Are you still there, Jide?
Thank you very much for that answer. I would say like I quite resonate with what you're saying, especially in terms of adoption, because we still have to battle with low digital health literacy. And I think that bears a correlation with Africa's literacy generally. So when people like are not very, very literate, how would you really adopt digital technologies in this case? Speaking about adoption of digital, how would you say the adoption of digital health technologies has evolved across Africa?
I mean, we have adopted digital health technology. We probably have more digital health technologies deployed in Africa than most countries, even in the Western world, because in a state, for instance, you probably have like 30 to 100 digital health deployed, and they are fragmented. One is deployed in one facility, another one is piloted in 2 facilities, one in 3 LGA, one facility in each of the LGA, and all those kinds of that. What you would think we should focus on is the scale of the deployed intervention. Many of them are not scalable and not even scaled, just very few, and those few actually in the private sector. And this is not just like almost all the countries in the region is having this issue.
I quite resonate with that because I've seen like in cases where, and it also boils down to the issue of interoperability. It's hard to ensure interoperability standards where there's difference in the kind of technology scale, the kind of technology in use, different technologies across different kinds of places and such like that. But in your opinion, what impact would you say GDHI has made on the progress of digital in Africa, especially in terms of prioritization? What should countries actually prioritize this year, 2024? I know we are talking about digital health in Africa this year. So like what do you think countries should prioritize? What should be on our priority list? What should be the highest on our priority list this year?
I do have a slide that I wanted to share to help people who are participating kind of understand what the GDHM is and where it started, and where and then all of the information about what should be prioritized would have been also presented there, because I assume some of our colleagues on the line may not know some information on the GDHM, and we're likely here to learn about it and then see where it will be useful to them.
Yeah, please do that. I would really love to know that too.
Okay, so just give me a second. Let me
No problem.
pull up my slide. I believe you can see my slide.
Yes, I can see it. I believe everybody should be able to.
Oh yes. I work for an organization called Health Enabled. We majorly work on strategies and support organizations like Gavi, Global Fund, and the rest. So the way I've structured this outline, of course, we've dived into it already, is to look at the overview of the GDHM, how it started, where it is now, and who are the users, and then some of the insights that we gleaned from the data from 2023. So there's a state of digital health report that we do. We strive to do every year, but the last one was done in 2019. And then I'm also part of the Global Digital Health Monitor Secretariat. And we also talk about how countries can participate, and even you here, how you can reach out if you are working in the digital health space, either in health or IT. And then we'll look at the platform itself. So that's a screenshot of the Global Digital Health Monitor. This is the redesigned monitor, and the monitor itself is a multi-stakeholder initiative. It's received funding from Bill and Melinda Gates, Philips, Johnson & Johnson, Global Fund, McGovern Foundation in its lifetime. It was launched in 2018 on the sidelines of the World Health Assembly. And the main aim then was to help countries easily use the WHO ITU eHealth Strategy Toolkit, which I know many of you probably know. And if you do not know, the WHO ITU Toolkit is a tool that WHO and ITU, the former health and IT agencies of the UN, they came together in 2012 to develop that document that countries use when they are developing their national digital health strategy. And so since its development, many countries, I think mostly in Africa, have used that thematic area, 7 thematic areas, to categorize and prioritize what area that they want to invest in. And they use that to then develop their strategies. And this, for us, we call it enablers. So if you look at the 7 areas are leadership and governance, strategy and investment, legislation, policy and compliance, workforce, standards and interoperability, infrastructure, and then the services and application that we often always talk about. So the problem that the Global Digital Health Monitor tries to solve is to find out, to help countries determine their level of digital health maturity. It's not easy for countries to do that, because and we want to make that happen in a standardized way. So we use a set of 23 questions to help countries do this. And then also countries would sometimes want to compare themselves with other countries, or the overall of their region, or even the global average. And the GDHM is also helping do that. And then countries will also want to prioritize, because they don't have enough resources. They want to say, okay, we have limited resource. Which one should go? Should we prioritize in terms of the needs? And of course, you will now look at the areas where you rank list, or the areas where you think would be critical for your investment in digital health, and then decide to invest in that area. And it's not just countries, even development organizations, donors are already, we're targeted for using GDHM to decide where they think if they invest their money in support in private sector, if private sector decide to invest in a country, they will look at, okay, these are the things that are in this country, these are the areas we should invest. Before now, they will spend money going to do expensive assessments, sometimes not yielding what they intend to achieve. So the monitor itself helps to empower these diverse stakeholders, and then it helps for benchmarking and for evaluating how implementation is happening, and then it motivates investments as the case may be. There are 23 indicators along these 7 areas, but it was redesigned last year, or last year and the year before, redesigned and relaunched also in Geneva on the sidelines of the World Health Assembly, and that redesign process ensured that we have things that were not captured in the WHO ITU e-health strategy toolkit, things like artificial intelligence, gender and equity, universal health coverage, and other emerging technology, even much more coverage of private sector engagement in digital health. And something interesting happened that last year, actually, the India G20 presidency, the Global Digital Health Initiative, Global Initiative on Digital Health was announced by WHO, and the Global Digital Health Monitor is a key component or toolkit for that initiative. Of course, it was launched on Tuesday this week, or the last 5 days in Ghana, and the toolkit that would be used to measure how countries progress is the Global Digital Health Monitor. Again, when it was redesigned last year, if you do not know already, the WHO has a global strategy on digital health 2020 to 2025. And that's how they drive what they want to prioritize, and then also encourage other donors to prioritize investment in different countries where they work. So to measure the progress they are making, both at the global level and at the country level, they intend to use the Global Digital Health Monitor, and the strategic objectives of the Global Strategy on Digital Health 2020 to 2025 by WHO. All of those strategic objectives have now been captured and aligned with the 23 indicators. It used to be 19 indicators, and there are a few changes, not to bore you with all of that. No, so the next thing you would ask is, who are those that have even at all used the Global Digital Health Monitor? So last year, Global Fund decided that they are going to use the Global Digital Health Monitor to benchmark and create a baseline of where the 50 countries that they are spending money on are, and then use that to prioritize investment in areas, particularly in digital health. Gavi developed their digital health strategy as well, and this digital health information strategy, and they are using the Global Digital Health Monitor to determine, and of course, in the countries where they work, to measure progress of how that strategy goes. Similarly, the Gates Foundation supported initiatives has used that for assessment itself. Countries use the GDHM for developing their strategy. I know that Nigeria, Sierra Leone, Zambia, and a couple of other countries, especially in Asia, use the GDHM increasingly for tracking, because the GDHM is based on the WHO toolkit. Then it's a given that when you need an easy set of questions to track this, and some subnationals are also using the GDHM. I know we've used it in Nigeria, in a few states, in FCT and Lagos. We've also, some people have used it in Iraq and in India. Those are the countries where those are the ones I know. And I know there are a lot of others we may not know. The World Bank, in its digital in health strategy, is encouraging investment in the foundational area, and highlights the GDHM increasingly. In fact, in a meeting we had earlier in the week, the World Bank actually made a case comparing Nigeria and Indonesia, and sharing with the minister and the Ministry of Health colleagues. Of course, the minister made a commitment that Nigeria will have to move forward beyond where we are currently ranked in the GDHM. That's to tell you that the GDHM is already getting to a policy level conversation. And of course, most of the data collection of countries in the 2023 version was driven by UNICEF, the regional networks in Africa, in Asia, and even the Society for Telemedicine and E-Health, International Society for Telemedicine and E-Health was instrumental in that regards. So I will just run through this because I've already spoken to how that, but again, this is typical example of what you can do. So you see in this chart, maybe I should just wait and then go to the link. You can also compare and benchmark. So you see here, they are benchmarking to the global average, but you can also do others. So here, there is no global average at the time because there's no global average for sub-indicators. And of course, it's not something to worry about because the calculation is based on the main indicator. So when I mean main indicator and sub-indicator, so you see where you have 2A is a sub-indicator, the main indicator is 2, and the average is computed using main indicator. But these are just technicalities that you shouldn't really worry about. So some insight from the State of Digital Health report that we launched in December at the Global Digital Health Forum. You would see that across board, the leadership and governance component is doing very well. But if you then move forward and look at Africa, you will realize that it's not doing quite as well. And the phases are 1 to 5. And of all, the workforce component is one that is that we are struggling with, given to, and this is giving credence to the earlier answer I gave you, that any area the area I would prioritize if I were governments in Africa is workforce. And if you go into country responses as well, many countries are ranked 1, some are ranked 2, and that's because the capacity in many different areas to design. Of course, we talk about digital literacy, but yes, that is a big issue. But even to use those 2 literacy is a problem, but to design, we don't even know what we are doing in that area to support, to develop the 2. And these are areas where we need a lot of support. So in terms of leadership and governance, despite leadership and governance doing very well globally, in the Afro region, leadership and governance is still not doing as well. And there are so many reasons for that. Example, countries that already have established governance, as soon as COVID came, many of them relapsed and the governance became moribund. So when they did in 2023, their governance were not active. So, and I think many of them are already reactivating those governance structures. And so looking at the strategy and investment, I just cherry-picked strategy and investment here. The key questions here are, do you have a national strategy? Do you have public funding for digital health? And is private sector participation in digital health? So you will see that, yes, just less than 25% are doing very well in terms of public funding for digital health, and more than 25% still do not have national digital health strategy or roadmap to say this is where we are going. In terms of private sector investment, 75% of countries in the world are saying that private sector investment in digital health is very low. And conversely, through other sources that we've looked at, we've seen that in Africa, which is our constituent, that only 1% of total private sector investment was directed at Africa, and 74% went to the United States alone. Of course, capacity has a lot to do with that, because you need to get your MVP before you can get the private sector. Of course, get the infrastructure in place before private sector will be able to have a trust, maybe political environment as well. So these are key issues. Of course, you will see that when it comes to workforce, the African region is ranked 2 compared to the other region. Even the other region all rank 3. That's to tell you that workforce remain a big issue globally, but much more in Africa. And of course, if we take a deep dive into the components that make up the workforce, whether digital health is integrated in professional pre-service training for medical doctors, nurses, and CHUs, you see that 50% of countries have not integrated digital health in pre-service training. In-service training, whether digital health is integrated in-service training, so when people get deployed to locations where they work as health workforce, do they receive training? Yes, I mean, tools get deployed and are trained for the particular tool, but standardized training on digital health seem to be something that is not happening, to the extent that 50% of the countries respond that it is not happening at all. And of course, we will say, okay, is digital health professionalized? It's not professionalized. There is no attempt at professionalization in 75% of countries in the global digital health that respondent. Of course, most of them countries that responded were in the global South, Africa mostly. So what's the outlook? Yes, we've seen that workforce ranks lowest, and what that means is that we need investment in pre-service and in-service training. A lot, not necessarily just investment. We need changes in how this happen, and career paths within the public sector. Make sure there is gender representation, because most digital health strategies that are there now do not factor in gender, and that's because either they were based on the toolkit, and at the time gender was not a priority issue and didn't come out clearly in the toolkit, in the WHITU toolkit. And then they need to strengthen capacity for designing, so the capacity for design thinking, capacity to model problems, from problems to UML solutions that can then be built out, and even the capacity to be able to build out digital solutions, and then of course the literacy to use them, and then capacity to provide support, all remain big issues that needs to be tackled before we can move the needle significantly in digital health. Of course, we need to position and ensure that there are more private sector investments on the continent when it comes to digital health. Standards and interoperability, most countries already have architectures, and some of them even have standards, but the rubber meets the road when we come to operationalizing and monitoring how these architectures are implemented. Infrastructure regarding electricity and network is a big issue. Of course, so a lot of the countries say they have a plan for supporting digital health infrastructure, but these plans have not been shown to scale. So that's something that we need to keep an eye on. So the question that will come to your mind now would be, okay, how do I participate? Because right now we are in the call for experts to reach out and help facilitate or engage in their country mobilization. There are multiple paths that you can join. You can be a digital health expert, or the regional networks can help facilitate this, or multilateral organizations like UNICEF and WHO and the Global Fund or the rest can also help facilitate this. And of course, they will facilitate this in the countries where they work. Or you can be the government focal person for digital health, which is the best, because the data that is captured in the Global Digital Health Monitor has the feature to flag the data as government approved or not government approved. And when you want to participate, you can request the link, and the way to request the link is to send an email to digitalhealthmonitor.info@digitalhealthmonitor.org. And then when that email is sent, you will then receive a further instruction, including maybe the country-specific link that you can then use to engage and convene your country conversation. Is typically a 90 minutes conversation where we encourage people to bring in diverse stakeholders in that conversation. And then that information is captured, and then either you can download and take it to the ministry, who then review and approve, and it becomes approved document. And of course, there are situations where there are no government established digital health leads in certain countries. Then in that case, the information could as well be submitted, but of course it won't be flagged as government approved, and there are justifications for each of the 23 questions. And then when that is done, the Secretariat will go ahead and review, get back to the submitting stakeholders with additional questions and updates, and then go ahead and publish. Then there is also opportunity for countries to be featured in two main events. We have two main events that we are intending to feature countries in. We are trying to we're organizing an event in Geneva on the sidelines of the World Health Assembly, and we are also calling for country case studies. But we're also looking at featuring countries as well in the 2024 State of Digital Health Report, and we are collecting case study reports. And a few countries were featured last year. I know we featured the Philippines, Zambia, and which other country? I can't remember. I think Moldova. So we are calling for country case studies. So still reach out using the info@digitalhealthmonitor.org, and we can provide additional information. And then, so when you receive it, this is what the form will look like, and you receive a link like this as part of that process. So I will pause here and see if anybody has questions while I go to the website.
Actually, we have a question and answer session at the end of the presentations, at the end of the discussion today.
Okay.
So any question probably be till the end of the
session.
end of the program. Any question will be at the end of the session itself.
Got it. Okay, so
are you done with the presentation?
I will just quickly go through the site. So you go to monitor.globaldigitalhealthmonitor.org. But you can also go to digitalhealthmonitor.org if you want to get more information on the platform. So this is the website itself, but from the website you can go to the monitor. So this is the website, and then I'll go to the monitor, which is this. And the monitor itself is what you have here. You can do many things. You can navigate, go to a country, and you'll see the information on the country. Get more information. You can navigate, look at the year on year. So you see in 2019, when this was called version 1, Mali ranked 3, and they are still ranked 3. If we want to see more, to check whether Mali's data is government approved, you will see this is showing that it's government approved. It would have been, if it was a lighter shade, this would be that it's not government approved. And you see that you can benchmark to the global average. And I can decide that, okay, let me compare this to Mali is Africa, to the African region, and I'm comparing. In that case, you see the benchmark is to the Afro region, and the spider chart is also showing that. Let's see another country. If we go to, let me be sure this country if this country is ranked 2. This country doesn't have all the data. Now, this is another information you should know, that some country data are pre-populated. So for instance, the information for Congo was not entered, the information was pre-populated using the available public data sources. And those information, you can also download the country scorecard, export the country data, look at regional data in Africa, the data for the different region, the different countries in our region. Sorry. So this is where and what you see. And you can see the different countries that are in the monitor. You can export all of the data here and go and do your own analysis. And this is something that the Africa CDC actually did. So they use this data as part of I'm sure you guys know, as Africans, the Africa CDC launched the digital health, Africa CDC digital strategy last year, digital strategy. And that strategy is what they want to use to drive how member states and support member states in the region for how they pursue their digital transformation journey. So they are hoping to use data from the monitor to help in tracking how that progress goes. And these are the questions that make up the monitor if you're interested, and the methodology if you're a researcher and you want to see how the information is captured. Here is the full detail on the methodology. So I will stop there now and then wait for your questions. Thank you.
Okay, thank you very much, Emeka, for that very wonderful presentation. I can say I learned a lot from that presentation, especially with respect to where African countries need to focus on the problems faced by African countries and the world in general in terms of digital health development and use. But in terms of, I'm a healthcare worker myself, so I can quite understand where you mentioned about the lack of capacity in terms of digital health among healthcare workers, especially the fact that Africa is ranked number 2. So in your opinion, what would you describe as some of the gaps and challenges faced by healthcare workers in Africa, especially with regards to digital health, and how can these gaps be addressed through workforce development programs, especially for doctors, nurses, pharmacists, laboratory scientists, and the likes? How can targeted workforce development address these gaps and challenges, and what are those gaps and challenges in particular?
I do think that there are multiple dimensions where we can engage when it comes to enhancing the capacity of our health workforce. And so there are different categories. Some health workforce need motivation, and some need the training to happen during pre-service, that is during training as undergraduates, while some do not have basic literacy. And when you go to the primary healthcare spectrum and go all the way down to the community health workers, you start to see the issue of the spectrum of where the literacy is a problem. But also sometimes digital, of course, digital can sometimes result in burden for the health worker. And this is another issue entirely different from capacity, but this is also something that heavily impacts health workers, where they would traditionally just do their work. Digital tool now exacerbates the work they do, in that they spend much more time trying to collect data rather than deliver the service. So there are many different dimensions, but capacity, literacy is a big issue, especially for the lower cadre. For doctors, the older professional will probably have challenge with literacy, in that, so for instance, you have a consultant who is 70 years old or 65, is not very technology savvy, that the literacy would be a problem in that area. But I think most young doctors do not have that challenge. And of course, to address this, it's a pre-service challenge. So once the curricula for clinicians and general health workforce factors in digitization as part of their curriculum, then they come out of the university having covered this area.
Okay, thank you very much for that. In terms of this, I feel like everything still boils down to the government. Are they willing to like undergo a curriculum shift, to change the curriculum, revise it to include digital health in it? So that's the case. And I quite agree with the fact that you mentioned young doctors. I think for our generation, we still have the propensity to become more digital health savvy, especially for the young healthcare professionals compared to the consultants and that are in the later stages of their life and close to leaving the workforce themselves. So I think there should actually be a focus on the because we like kind of catch them young, as catch the young doctors, young other young healthcare professionals young to implement that. But in terms of this workforce development and workforce capacity development, would you say since it's actually the government that is responsible for initiating processes for that, would you say there's actually a link between the load capacity of the African healthcare workforce and the government? Like, do you think there's a link between the government not willing to initiate, that is poor leadership or poor governance in our healthcare systems, and this low workforce capacity?
So I don't think government is entirely to blame for our debts in digital health workforce in general. So, and this is when I mean digital health workforce, I'm talking about literacy, capacity to design and develop and use and support. So the universities, the way they do is that you make a proposal for a course, and then the NUC will, or for course changes, NUC will approve, NDCN will provide their inputs. But again, even the CHUs have their own curriculum, which is, so it's not just one area. I think it has not been emphasized in the past. And I do see a lot of emphasis in this area recently because the minister, the commissioners, everybody seem to be talking about digital. And at the global level, WHO is prioritizing it. Like I said, they launched the Global Initiative on Digital Health on Tuesday, and they even have a global strategy. WHO has a global strategy. It means that they are prioritizing it. In fact, WHO has even developed a competency framework for digital health. And this was something that they finalized early 2023. So there is a movement. It wasn't prioritized in the past. And I don't think government will push back. I think everybody has a role to play, the civil society, the private sector, because the advocacy seemed to be working. It's just that it hasn't been mainstream. And I think I heard that even a few College of Education may have started introducing digital, but of course we need it to be structured. I mean, I'm talking about Nigeria now. Of course, there are a few countries that has done well. When you look at Ethiopia, for instance, Ethiopia has done marvelously well in capacitating the health workforce when it comes to digital. But the problem they now face is they are churning out more health informaticians than there are opportunities to fill the gap. So these are lessons we could also learn from Ethiopia and other places that have done well in upscaling the capacity of their digital health workforce. But even in Ethiopia, they have certain level of digital health workforce. They are not there yet, and they could still go and do better than what they've done. But they've done a marvelous amount of work there, both at the university level, both in apprenticeship, internship, mentorship program. They post informaticians to all health facilities. I think they are doing an amazing job there.
So I quite agree with you in that regard. Ethiopia has really done a lot of putting a lot of effort into the digital health training, and it just shows that if they wanted to, they will. If anybody wants to, if any country wants to focus on this, they will. So that comes to the end of our discussion. But just for the last question of the day, what is your expectation for digital health in Africa this year?
This year, I would, if I were in government, I will invest 80% of my funds in capacity building. I mean, not the traditional capacity building, like the core skills needed. Bring in developers from other field, give them the healthcare problems, and make sure that people see the value in investing in digital health skill, enhance the competency, make sure there are curriculum reviews and changes, drive the policy from all the incentivize those policy changes to ensure that the next generation in the next 2-3 years will already address many of the problems that we see. And of course, that's really what I see. Infrastructure, of course, governance is a given before any of this, but capacity and infrastructure. But infrastructure is not just it's not just a health problem. So infrastructure for digital health is also infrastructure for digital agriculture. Maybe to do targeted investment in infrastructure. Here, I'm not talking about buildings. I'm talking about electricity and network and the computing devices. And you need experts to be able to work on all of these areas. So capacity is key.
Thank you very much. I actually agree with you in that regard. All we need, if we can actually build capacity and build our infrastructure, we will to solve up to 90% of our problems gradually. I think Africa can do it. We just need a lot, focus a lot, and put our priority there. And that comes to the end of our presentation, our discussion today. I will just leave the panel open to any member of the audience that would like to ask our speaker today any question that you've been able to you wondered on, especially because of this presentation. Any question even outside the topic today relating to digital health. The floor is just our amiable audience. You can decide to unmute yourself and ask, or just use the comment section. We'll be taking 2 questions each. Almost close to the end of the day. Thank you. You have the floor.
Good afternoon, everyone. My name is Manu Kawayo, streaming in live from Zambia. So my question is, Emeka, this is directed to you. My question is, how has been youth engagement with regards to the digital health monitor? The time that information was collected all around the world, how was a youth engagement leveled up? Were there youths engaged, or how is it like this year? How do you intend to incorporate youths in ensuring that the digital health agenda is achieved towards 2030? Thank you.
Thanks very much, Muno. It is actually a very interesting dimension. We did not look at that dimension. How we track or get the information is we rely on the country experts. And of course, when we are talking of experts, years of experience, once people start gathering years of experience, they also move away from being youths. So the dimension you are bringing now is something that we should keep an eye on. I think I would say thank you for bringing that up. I will take it back to the Secretariat and we'll see how we track that. Yes, we are tracking gender, making sure that there is gender balance in the conversation. But youth specifically, we did not. Of course, we are looking at equity, but not from the lens of youth. So we will do that. Thank you for that. I hope that answers your question, Muna.
Yes, you have. Thank you so much, Emeka.
Sure.
Okay, Anvil, over to you.
Good day. Can everybody hear me?
Yep.
My name is Anvil. I'm all the way from Cape Town, South Africa. With regards to the capacity builder, or the capacity building, I'm working on a project with regards to predictive health and monitoring. And one of the challenges that I've incurred was funding, and not only funding, but also the engineers and the data scientists that are required to build the infrastructure for the program that I need to run, that will encompass interoperability and health records management, everything. My question is, with regards to investing 80%, like you said, you'll invest 80% in skills, capacity, and building those skills. My question is, who do we talk to with regards to that funding? I've been knocking on so many doors, and what is holding back the project from launching is the funding. And I just want to know what are the right doors to knock on to get the ball rolling. So in order to outsource, skills from other countries like India or other African countries. Thank you.
Yeah, thanks very much, Andrew. This is you're asking a question that yeah, I totally share this sentiment, because like I said, yes, if I'm in charge anyway, I will make sure that 80% of my effort goes to capacity, because once there is capacity, a lot of other things. So people, even capacity, once people have capacity, they will be able to regulate. They have capacity, they will be able to build, like engineer. So when we talk about, and I share your frustration to have engineer. In fact, one of the programs that I try to toy with in the past has been to a mentorship and apprenticeship program where these core skills are acquired. So when in Africa, what we do is we churn out graduates. And now I'm trying to focus on the engineers and the computer scientists and the data scientists. We just churn out graduates without hands-on experience. But what we do need, what you need, Anvil, is hands-on experience, which the Indians have, and other highly developed African countries, maybe in North Africa or even in South Africa. And I don't know if you are in South Africa and you are complaining, then what would you say in West Africa, where it's even much a bigger problem? And when you go out for funding, which is the question you are asking, the funders are not looking for this core skill to fund. The funders want to fund AI and like a certain level of AI because the priority is that. Maybe you are trying to fund core skills of DevOps, Linux, administration, or ability to develop a back end using a certain specific programming language. How do you write a proposal for that type of funding when there is no even call for that type of funding? My advice for you, though, would be to figure a way to partner with organizations that receive larger funding for other kinds of capacity building, and then you kind of leverage the resources to do those other capacity building that also do these other core ones. That's my advice for how to go about that. But again, maybe we should start to look at African funders as well for these core skills, because this may be what we really need to get ourselves out.
Thank you so much, Doc.
Thanks.
Okay, so everyone, thank you very much for coming today. We've come to the end of this discussion. Thank you very much for amazing audience. Thank you very much to our speaker, Mr. Emeka Chuwku. You were like the perfect fit for this discussion, and I'm glad you've been able to share valuable insights with us. And I hope we as young people, we can go on to become change advocates, to encourage people around us, to encourage government to sit down with them and encourage them to prioritize data in Africa. The world is our oyster, and we can make a lot from it, especially with regards to digital health. So make sure you follow our social media channels to get more news information about digital health in Africa. You see various posts enlightening various digital health topics in Africa and even beyond the world in general. So until next time, I'm Jide Babaji, Programs Manager for Digital Health Africa, and we'll see each other. Thank you very much.
Thanks everyone for having me. And like. Right, thank you. Bye-bye.